So if one person restrains, and the way we restrain is just an arm under the neck like that, and then if you put a hand down and kind of just put, we just say you're just kind of pushing gently on their back, but you're not really holding them. You're just, they always say if they stay balanced, they're more comfortable. So if you hold them and pull them, then they're always kind of not as comfortable. So you're just putting a fence around in front of their neck and then just having a hand on their back, and that usually works. So the way I give an intramuscular injection, we're just going in the thigh muscle, which is right here. You can feel through, and I'm just using a hand to kind of hold them in place. I know you can use their tail to hang on to them if you need to. And same deal, we're just going in the thigh muscle. I kind of go straight in from the side, and I put the needle in and just push it in. And we don't have to worry about aspirating. Being a nurse, they'll know to pull back on the plunger. It's okay if either of these drugs go in the bloodstream. They're both labeled for IV or IM use. So just in the thigh muscle, poke and push the plunger, and you're done. Faster
Great.
the better.
Thank you.
Go ahead.
So you're saying.
So feel, yep, and we want to feel thigh muscle. So I come in from the back because there's no fiber on the inside of the back of the leg. So if you reach in from the back, you
Yeah.
can, that's always the hard part on these guys is understanding where anything is because they're all just fuzz. But if you reach
Yeah.
in from the back, you can really feel the thigh muscle, and we
Yeah.
just want to go into that muscle. So I usually go in from the side.
You're saying like this?
Yep, yep.
Since I'm being filmed.
Don't
I
poke your
use my
hand.
mouth.
And you can just get down to the fiber and poke straight into the muscle and just push the plunger. It's that easy. Okay, so shake it well to mix it up. It is a suspension, so shake it well.
He's a good
That's
teacher.
good. And then uncap it, and nothing needs any special storage as far as refrigeration.
Okay.
We just don't want it boiling or freezing or out in the
keep it
direct
in
sun.
car,
So
yeah.
yeah, we should be good weather-wise. So again, it's 30 mils orally, one time daily of this dewormer. So we're gonna give 30 mils of the fenbendazole dewormer orally once a day. And this is an oral drenching syringe that you can slide between the cheek and the teeth. And we slide it in pretty much all the way as far as the syringe will go in, and then just slowly squirt it in. You don't want to blast it in because then they can inhale some of it and they'll cough and sputter. So we just, once we get it in place, we slowly push the plunger and let them kind of drink it. And if they fight and pull out, you just give them a second and catch them again and give the rest of it, and it might take 3 or 4 attempts to get it all in. Unfortunately, this is a 20 mil syringe, and we need to give 30 cc's. So you can either give 20 and 10 or 2 syringes of 15 or whatever. So if you want to spin around to the other side, we'll show.
Doesn't want
So
to go
if one
that way.
person holds for you, it's kind of a 2-person job if you're not experienced at it. And we hold their head, we don't want their head straight up, just like trying to drink if you're looking up is harder. So it's okay as we're putting the syringe in if we go to that position, but we put it in the corner of their mouth, slide it back in, and they'll kind of chew on it a little bit. And then I'm just gonna slowly depress the plunger and see how we're just kind of basically drinking it. The syringe is kind of on the back of the tongue, and I'm just giving it nice and slow. Our head is in a pretty normal position. We're not looking up to the sky. And I know you're gonna lay down. I know. And there, I didn't want to fight. We struggle. We can let them take a break. Swallow what's in there. I'll finish up with this amount. I know. Just putting this in the corner, sliding it back in, and slowly pushing it. And so that was 20 mils, and we don't worry if a little bit comes out on the lips. We have a good dose in there. So we'll fill this up again. Next, you want to be real gentle and head nose down as much as possible. So there you go. And slower. We're not drinking it. We're just holding it in our mouth. There you go. We want to see some motion on the mouth like that.
Oh, I think I was in between his teeth. That's why.
Yeah. Perfect. And he's an excellent patient for that. That's as easy as it can go, so I hope it's as easy for them. But
He gets